So with this general outline, we will be seeing the different parts of the pharynx. Now, you will have to bring this down here with the space right here, okay, so that you will be able to draw all the structures in the pharynx. Now, the first question is, which they ask in this, is about the nasopharynx. I told you they do not ask much about the oropharynx or the laryngopharynx separately, but the nasopharynx they do ask. And also, even if you are asked about the pharynx for your practicals, they would go into the nasopharynx also a bit in detail. So just to see the structures which are seen over there. Now, to know the extent, we said the nasopharynx, the roof, what do you see there? As we said earlier, the basi occiput, this area here, the body of the sphenoid, and basi occiput would be forming the roof. Above that, this is a sphenoidal sinus, that space over there. Now, right in front of this body of sphenoid, there will be, so this whole thing would be covered with your mucosa over there. The nasopharynx will have your respiratory mucosa, which would be, you have your, like you saw in the nasal cavity, you would have, you need cilia, that, so you have your pseudostratified ciliated columnar epithelium would be there in the upper part of the pharynx, as in the nasopharynx. Structures that you see in the nasopharynx. One would be the nasopharyngeal tonsils. Okay, you should not equate this to adenoids, because adenoids would be the condition in which the nasopharyngeal tonsils is inflamed and enlarged. So that is not a normal condition to see an adenoids, although maybe in layman's term you would say he has adenoids. It means whereas the adenoids means, it is actually meant to mean the enlarged nasopharyngeal tonsils. Right here you have a bit of lymphoid tissue which is forming the nasopharyngeal tonsils. Okay, so that is one structure that you see over there. Now, you have learnt in the nasal cavity that there was the three concha. You had the inferior concha, the middle concha, and the superior concha. Behind the inferior concha, if you trace it back in your sagittal section for your practicals, you will see that there is an opening right here. Okay, that opening is the medial opening or the nasal end of the auditory tube. The auditory tube, or what you have learned in your school days, the eustachian tube or the auditory tube. The medial end, it's opening into the nasopharynx. So this is the opening of the auditory tube, also called as your eustachian tube, also called as your salpinx. Why you should remember the name salpinx is, many terms are related to salpingo something, that is if it is a structure which is extending from this area. Okay, so remember about this opening. Now, above this opening, you will see a kind of a projection over there here in this area. This is called as your tubal elevation. Okay, this is your nasopharyngeal tonsil, this is your tubal elevation. Okay, that is formed by the cartilaginous part of your auditory tube. Now, below this, you can see that there will be a fold which is coming here. Where is it extending from? Where to where? From the salpinx to your palate. So what would you call that fold? Salpingo-palatine fold. So that's your salpingo-palatine fold. It does not contain a muscle named salpingo-palatine muscle. There is no muscle like that. Three other folds. So altogether 4 folds, in 2 in the nasopharynx, 2 in the oropharynx. All of them have the name of the muscle according to that fold. If you say salpingo-pharyngeal fold, that is a fold which is going to go to the pharynx, it will contain a muscle called salpingopharyngeus muscle. And here also you have other folds, it has the muscle named accordingly, but this fold does not contain any muscle according to the name of the fold. So just remember these 2 folds, salpingo-palatine fold, salpingopharyngeal fold. Salpingopharyngeal fold has the muscle in it, deep to it, named as salpingopharynx, which is going to the pharynx. You have behind this salpingopharyngeal fold, there will be a deep recess over here. Okay, this recess is called as your pharyngeal recess, or it is also called as your fossa of Rosenmuller. Fossa of Rosenmuller. molar. It's a deep space there. Now clinically what is important is, if you're going to go deep to the space, you're going to go, that's on the lateral, this is from the medial aspect, you're going to go laterally, very much laterally, you will have the carotid vessels over there. So if there is a carotid dilatation, you might accidentally prick it if you're doing any procedures over here, very much deep. Okay, so that is your fossa of Rosenmuller. So here you would have a muscle called as going to pull up this structure that is moving down, that's your palate, going to elevate the palate. So elevate. So you have the levator villi palatini to elevate the palate. So levator villi palatini. So these are the important things that you have to remember in nasopharynx. Just to recap them once more, what all are the structures that you see here? Here you are going to see the nasopharyngeal tonsils, which if it gets enlarged, adenoids. Second thing, opening of the auditory tube, also called as the salpinx, also called as the eustachian tube. That's the medial end of the opening of the auditory tube. Third thing, you have a fold going from the salpinx to the palate, salpingo-palatine fold, a fold from the salpinx to the pharynx, the salpingo-pharyngeal fold, which contains salpingo-pharyngeal muscle. Behind that fold, you have a fossa of Rosenmuller. So this is a basic minimum that you should know about the nasopharynx. Applied importance, what is it? You can have enlargement of this, which we already said, adenoids. You can have, if you have a infection, you're traveling, you get a running nose, okay, that's mostly caused by a virus. You will have the infection spreading in this area, and then it can reach also this opening, that is your auditory tube, which will track down to your middle ear cavity. So you can, in the beginning of your cold, you will feel that your ears have closed up. Why is that? Because the secretions that accumulate here, the infection is spreading through your auditory tube. You will close your nose and try to apply pressure, which will try to open up the auditory tube. Even if you swallow or you drink that on, that can also help to open up this auditory tube. So very often, if there is a infection in the nasal cavity, it can track down to your ear, that is a middle ear cavity, and cause an infection in the middle ear cavity also. So it should be treated. Okay. So that's the applied importance about your nasopharynx.